This is an agenda for today that will have a brief welcome and overview of the scope of this particular plan. We'll talk about the initiatives that were developed as part of the plan, and then we'll open it up for a discussion. Just to, whoops, won't let me move on the slides until I acknowledge that we are being recorded, which we are, and I was just about to talk about this. So we are being recorded. And this is important because we do want to be fully transparent about the process. So you will receive a link to the recording if you registered, which you obviously did since you're here. This is available to other stakeholders, so it's something that you can share. The meeting tomorrow will also be recorded. They are the same agenda, same thing, so you don't have to worry about being present for both. We're asking that you utilize the chat box function if you have a question or comment, and also that if possible, you save your questions for the Q&A, which will follow the presentation. It's really important to us that we have as many voices represented in this. And so we'd like to be able to share everything that we're doing so that you can have kind of a full picture of the strategy and then bring in the questions in the discussion. I'm very aware, so yes.
Wendy, do you want to advance the slide to the ground rule slide?
I'm sorry?
Do you want to advance the slide to the ground rule slide? Right now we're seeing the title page.
Oh, why did that happen? That's really weird. It's on my end. We are, thank you.
Oh, perfect. Mm-hmm.
Okay, so sorry. On my screen, it didn't look like that. As you can tell, we've had a couple technical glitches as we've prepared for this meeting, but hopefully good vibes. It will all be good. Okay, so yes, thank you. My background is primarily in higher education, and I'm a teacher at heart. And so I'm always thinking in terms of how can I engage people in multiple ways, people who want to speak, people who don't want to speak, who all have something to contribute. And so because of that, we will send a follow-up survey after this to solicit any additional feedback you have. And please don't feel obligated. It will be very brief. It probably will just be something along the lines of, is there anything else that you would like us to know? And the intent of that is, if there's something that you didn't have time to bring up today, or you didn't feel comfortable raising the question, or you wanted to go back and talk with some of your colleagues and then bring some feedback back to us, it's just to provide a way that we can make sure that all those voices are heard. So watch for that email if you want the opportunity to provide some additional feedback after this meeting. And then we would just ask, as we move into the discussion portion in a little while, that you be mindful that there's many different stakeholders and perspectives, and we do want to allow time for as many voices as possible. So just being aware, as we went through the registrations for this meeting today, I was surprised by how many different groups are represented here, and the breadth of questions that touch on every aspect of behavioral health workforce needs. And so in order to allow as much discussion as possible, just be mindful that there's other people waiting to speak their piece as well. Okay, let's see if this will work. I think it did with advancing the slides. So just to orient or reorient you to where we are, the task force that worked a year or so ago identified 6 pillars that were necessary for a strong behavioral health system in Colorado. And you can see the pillars here: whole person care, access, affordability, workforce support, accountability, and then local and consumer guidance. And none of those work in isolation, right? They're all part of the same whole. So we're going to be focusing on the workforce part. That's the whole purpose of this strategic plan. But keep in mind that it is tied into all of these other areas. So as we were working through the strategy, foremost in our minds was, how does this increase access? How will these initiatives bring greater access to more services, to more Coloradans. How are we going to be accountable? How are we accountable for the dollars? How are we accountable for the outcomes? How is this going to engage with people on a local level? How is this going to meet the needs of people, out in Craig, up in Sterling? How is this going to look in Colorado Springs or in Durango? Just very mindful that that all of these pieces had to be part of the consideration and part of the strategy. And then just to refresh your memory, because I know many of you were probably involved in some of these efforts, the legislation itself, so SB 22-181, came in response to the recommendations that were made, which we'll touch on in just a moment. So when we developed the strategy, we weren't starting from scratch, and we weren't doing that in a vacuum. We were going back to, this is what the legislature said were the needs, and this is why they gave us funding to address those needs. And so we are directly accountable for what they, told us to do in this legislation, building off of all this work that had already been done. We felt like we needed to be stewards of the work that had been done, and not go off in a completely different direction. And I'll talk about our methodology and how we went about that. But just to first kind of get us all on the same page, what these various efforts did was establish that when it comes to workforce, there were some critical things. Number one, we don't have enough providers. Number two, we're not doing enough to recruit and retain people. And number three, in some areas of the behavioral health workforce, there's not enough training and or regulation. Those are two separate things. So I don't want to imply that they always go together. Some cases, it was just an issue of not having sufficient training. Others, it was not having sufficient regulation. And in some cases, it was both. But these were things that were identified by these prior bodies that conducted the work on the task force and the other groups that have been studying this issue for the last 2 to 3 years. So then the specific charges within the legislation were to promote the profession, in other words, expand awareness about opportunities, career opportunities within behavioral health, create opportunities to grow. So it's not enough to just say, you can get an entry-level tech position, down in Pueblo at the hospital there, but we want people to see that there's opportunities to grow. We also want to professionalize the work they're already doing, right? Like we don't want to ever create a perception that some work is not valued. But a key part of retention, and this is not just true in behavioral health, but it's true across every sector, a key part of retaining people is to show them that there is a progression. For those who want that, they need to see that I have somewhere to go. I can learn more, I can gain more skills, and there's a way to utilize that in my career. So creating those opportunities to grow within the field. Another thing was building a coalition of peer support specialists, which was specifically addressed, and we'll talk in more detail about this. And then there was huge concern throughout the bill for making it relevant. So making these workforce efforts relevant to people, regardless of where they're at geographically in this state. We are tasked with taking this specifically to rural areas, because that's a huge part of access to care. We cannot provide access to care for those in rural communities if we don't have providers and clinicians in those rural communities or serving those communities. And there's other areas, more populated areas that have unique considerations, right? Unique needs. And so there was an awareness as we went through this process that we needed to be deliberate in how we planned to engage with stakeholders across the state, not just in the Denver metro area or along the Front Range. And then lastly, to offer loan forgiveness and scholarships Sorry, let me make sure that I'm on track with my slides. That was also called out in the bill. So I want to put one little caveat with this last one on the loan forgiveness and scholarships, because this is probably the only time that we'll discuss it in the meeting today. And that's because the assignment for carrying that out was given to the Health Services Corps and the Department of Higher Education, who are charged with providing those scholarships and running the loan forgiveness programs. So while we coordinate with them and we talk to them, it's not part of our workforce strategy, because that's a piece that they are administering, and we're simply here to support however we can. I also do want to acknowledge that there were several related funding allocations. And so there might be specific things that you were wondering about, you were hoping to see funding through this bill, but maybe we're not addressing in this bill because there was already a separate allocation in one of these other related bills. And this is, I think, probably just a partial list. As I mentioned, in this bill specifically, there was money set aside for the community college system and for the Health Service Corps to accomplish specific charges that were given to them. We also have 1281, which is designed to support the substance use disorder provider network in addressing things like retention and recruitment. There's 137, which provides scholarships. That's being handled through the Department of Higher Education. And we will be referring to what we're calling for right now the LMS project. It'll have another name. It'll be branded within the next few months. But that was initially funded last year and has been in development this year. And so 181 just gave additional funding and set some stipulations about how that would go into the LMS project to provide more training, more professional development opportunities in the behavioral health field. There's also several other related bills that were for specific groups. There were funding things that went to strengthen, for example, mental health support available in schools, K through 12 schools, funding for children, youth, and families. And where it has workforce pieces, we work with them, we support them and offer whatever help we can from our end, but we're not responsible for the strategy of those bills. We're here to support the strategy being developed by those state agencies that own the accountability for those pieces. Okay, so let's talk a little bit about how we came to this point. As I mentioned, we are accountable to the task force and prior work that has been done to establish the need and lay out some priorities for what the state needs to accomplish in the behavioral health space. So when it came time to do the nuts and bolts, right, the legislature approved the bill, the funding is now there. What we did was we convened some small work groups between all of them, and you can see the areas here on the third bullet point. There were 4 work groups that had these topics. There was some overlap, so we did a little bit of coordination between groups. But between all of them, we had representatives from 12 state agencies. There were over 40 staff people who participated in one or more of the groups. We met every week throughout the summer, and we focused on these particular areas as well as coordinating within our agencies. So most of the people who participated were representing their agency. So they would go back during the week. We frequently had homework assignments for people to gather data or to, bring back more information for the group regarding programs that were already in place or, opportunities that would address these prioritized imperatives if they had adequate resources behind them. And so it was a fairly intensive process, both time wise and in how much we relied on people to do additional work outside the scope of coming once a week for a meeting. I also want to frankly acknowledge that this was just the beginning of collaboration. And as we move into the implementation phase, the collaboration will probably scale up, meaning there will be more people involved. As we implement specific strategies, there will be more committees, more work groups convened to actually move these individual things forward. As we bring together people to say, for example, if we're going to have a grant program, what are the parameters of the grant? How are we administering it? What's the accountability plan? What's the assessment? Those won't happen in a vacuum. We will definitely be inviting participation and input as we move forward. Okay, so moving on to the workforce initiatives, the heart of why we're here right now, which is what are we doing in response to SB 22-181? And I want to just throw one tiny little disclaimer that as I'm presenting priorities, with a couple of exceptions, you won't see specific dollar amounts attached to them. If there were dollar amounts called out in the legislation, which there were for many of these, then you can count on what's in the legislation. We're not changing. If the legislature told us to spend 1.9 million, then we are spending that on that particular focus that that we were told to do. But with the actual, again, keep in mind, we're in the feedback process, right? And so the actual dollar amounts are being worked out still with those stakeholder groups on some things, the things that weren't specific, and will be in the final strategy that will be presented to the legislature. Okay, so we put these in order of prioritization, right? But keep in mind that there's a little bit of approximation there. And these first two are a perfect example because it's not a first and second priority, it's a joint top priority. So the two top priorities that go hand in hand are expanding the peer support workforce and piloting a behavioral health aid program. And for those of you who have served on previous iterations of the task force, and I just realized that my slide didn't catch up, sorry. There we go. This would be the Alaska model, if you're familiar with that previous discussion surrounding that. These are both things that were included in the legislation that we're mandated to do. And funding is already set aside for these two things. So to expand out on this a little bit so that we're all on the same page of what we're talking about, what this money will do is support the development of a statewide standards and certification program for peer support, and it will incentivize people participating in that. So providing scholarships to complete certification, making training accessible statewide, providing some organizational support to do this, and obviously to promote the profession, to show people why would you want to be certified? What's the value in it? And for those who are not currently in the workforce, this is a good entry point for many people into behavioral health. So to do some marketing and recruitment around that. And then the behavioral health aid program, really this is creating a network of paraprofessionals within the field that have a few different tiers, and what they're able to do increases as they move up the tiers. A couple of reasons why this is compelling, and I think why it was included in the legislation is, one, there is success in other states, not just Alaska, but in other states that have adopted this model at billing Medicaid. So from a workforce standpoint, an employer standpoint, this is appealing, right? Because this means that we're able to use these people in valuable ways and to fill much needed roles within the field, and have the confidence that we can work out a way for Medicaid reimbursement. It also, from a workforce standpoint, it allows more people entry into the workforce, and it allows support for our existing clinicians to hopefully take some of the burden off of them so that they can focus more on the crucial aspects of their job that, for example, if you have a master's level therapist or doctorate level clinician, that there are some things only they can do. And this follows a model that, most other professions have, right? Of having paraprofessionals who are legally and in regulatory ways able to carry out functions that are appropriate for that level. And the behavioral health aid model that we'll be setting up does have multiple levels. So it acknowledges that people can come in at one level, but as they gain more education, more skills, they can move up in that within that space. And if they come in already with a bachelor's degree, then we can align with them, so we can match where they are appropriately. One of the things that was called out in the legislation, and now I'm going down to the third bullet point here, was to identify barriers to workforce entry and then work to eliminate those barriers. One of the biggest barriers that we found over and over again was the pre-licensure phase and the internship phase for clinicians. And what we especially heard is that for members of underserved populations, this is where we are at high risk of losing them. Because if they have to make a choice between completing an internship, an unpaid internship in many cases, or working to support dependents or themselves, if it's a choice between giving up a job so that they can do fulfill these clinical requirements, that sometimes that is what ends up propelling them out, and which is a shame, because this is often when they're so close, right? They've already overcome so many barriers to get to that point. So the really second priority, even though it's the third bullet point here, the second priority was to provide a way that we can offer support to people in that position. So offering paid internships, stipends for pre-licensure to remove that barrier. And then we're also charged with strengthening career pipelines. And this can be anywhere from the K-12 system up through. We're well aware that there are a lot of organizations, institutions that already have great programs. And so our third priority here is to support that. And we decided to do that through grants. So these organizations that are already doing this great work can apply for funding to scale up, to increase outreach to rural areas, whatever it is that where they feel like they can move the needle. We'll turn that into a grant process so that we can get a little more movement in our career pipeline development. Behavioral health apprenticeships were also noted in this, in the legislation. We have some really solid apprenticeship work happening in the state of Colorado, and we're confident that additional funding can build that out. We're already working with CDLE to identify areas that are apprenticeable. I don't know if that's a word, but there's some professions that are very challenging to convert into an apprenticeship model, and there's some that lend themselves very well. So they've already started on that work to identify a good fit. And once that's done, once we have a short list of apprenticeship professions, we'll then move to identifying employers. And this is all, they are so good at this, right? This is what they do all the time. So this is just us saying, thanks to the bill, we can support additional funding to expand out in the behavioral health space as far as apprenticeships go. Okay. Continuing on, the next priority, and it takes up this whole slide because it was called out in the legislation in several places, is to expand the LMS project. So many of the areas of needed attention that were identified came down to issues of training. And you'll note that there are a few areas of training that were listed in the legislation. And as our work groups convened, they also came up with additional topics that they felt like were really critical. So like I referred to earlier, this was started a year ago. So some of this is already under development and the trainings are already being created or are created, getting ready to launch. And what this funding does, is it allows us to, instead of just having a few isolated courses, it allows us to have a really robust central hub of learning for all things behavioral health. So that in addition to all of the online training modules, which are being developed and that will be directly relevant to behavioral health professions, in addition to those, it will also be a place where we can, we really see it as like a one-stop shop. So it'll be a place for training resources. You can have a database of trainers on different topics. So if you're looking for trainers to do face-to-face in particular geographic areas, you can find that. If you want to do live webinars, we plan on hosting live webinars to bring in people with professional expertise and also with lived experience to address some of the things that our practitioners are working through on a regular basis, and to help all of us, I think, elevate our vision. Like, how can we do better when we talk about equity in behavioral health? How can we do a little bit better? What are some of the practical, actionable things that you can do on a clinician level, on a institutional level, in order to move the needle there? There will also be information, and I should really mention, we're not going to reinvent the wheel and do some of this from scratch. Some of it we will be creating, right? Because it either doesn't exist or it doesn't exist in the way that we need it for the state of Colorado. But for many things, so for example, we also want to have links out to career pathways so that if you come on the site to do a training, you can see what this training will mean for you if you want to take it over into a particular career pathway. And this is work that the Workforce Development Council has already done so incredibly well. And so this is something that we collaborate with them and coordinate with the efforts that they're already doing. But really just envisioning this wonderful repository of best practices and resources for everyone in the state. And that's another thing. We want it to be something that anyone can access for behavioral health related training. So it's not limited just to people with certain credentials after their name, but it really is a tool for the state that serves the state of Colorado. And then the last few priorities that are called out as far as specific projects, retention. We're charged with addressing retention. And if you've ever tried to hire people, or worked in that space, you realize that this is a tricky one, right? It's complicated because there's so many different variables that play into retaining employees. And the reasons that people leave and don't stay and be retained are so different and so individual. And sometimes there are systemic things, right? Like if you're paying a low wage compared to every other industry out there, that's a systemic problem that needs to be addressed at a systemic level. But sometimes retention can be incredibly individual. One employee leaves because of childcare issues. Another employee leaves because they're caring for an elderly parent. Another employee leaves because transportation to the job is problematic, and they decide to get a job closer to home. There's so many factors that go into retention. And so as we discussed this one and circled around what data we had and what anecdotal things we were hearing from employers, what we ended up circling back to is that we want to provide, because again, this is one-time money, right? So that's a blessing and a challenge, because we can't just go out and say across the board raises for everyone in the field in the state of Colorado. We could do that, but it would last for a year or so, and then we're right back to square one. So what we decided to do is offer grants directly to behavioral health employees, and it'll be tied to a dollar amount per employee. So every employer, from the smallest to the largest, has an equal opportunity to apply for the funds. But we're really inviting the employers to say, what would make a difference with your employees? Hopefully having conversations with your employees, which hopefully they're doing. And if not, maybe this will be an incentive to have those conversations, to say, what are the real, concerns that would cause retention to be a struggle, for you, and what are some things that we can do? And we're hoping people will be creative with this, and that they'll maybe think outside the box and listen to their employees. They'll hear the real concerns. What we would love to do on a state level is share this out and be able to say, this is what some other employees are doing, or employers, sorry, this is what some other employers are doing, and this is what they're finding success with, because this problem isn't going to go away in the next year or two. This is a long haul problem that we're trying to solve. So we really want to start trying things and figure out what works. And this money is a chance to do that. It's a chance to do some trial and error and some experimentation. In that same vein of creativity and innovation, we wanted to set aside some money for innovative recruitment strategies. And I realize that's kind of vague. So just to give you a little closer sense of what that means, we know that there are some professions that are particularly acute right now. They're suffering a particularly acute shortage. And we want to help. But again, it comes back to, there's not a one size fits all strategy that addresses recruitment, in part because what involves successfully recruiting a psychiatrist to work down in Alamosa is going to look different than what recruits a psychiatrist to work in Boulder. What recruits a nurse practitioner to work down in Florence or Canyon City is going to look different than what recruits a nurse practitioner to work up in Sterling. We're very mindful of these differences and the need to be adaptable and flexible to each organization. And so when we say setting aside money for innovative recruitment strategies, what that really means is we want to identify those areas that have the most severe shortages, those professions, and in some cases, perhaps even the geographic areas or specific fields within behavioral health. And then we want to say, what could we try that hasn't already been tried? What might help move the needle? And I don't know what those answers are. That's where, again, like implementation phase is going to require more collaboration and more work within our specialized groups. But to give you an example of, one of the things that was thrown around when we were coming up with the plan here was that we know some of our facilities are experiencing severe shortages, almost 50% of vacancy rates with nursing staff in behavioral health. And of course, they're competing with everybody else who wants nurses as well. And as we started digging into that one and trying to understand, well, what are the factors? What are the barriers? One thing we realized is that most nurses going through their training spend very little time comparatively in a behavioral health clinical rotation. And so we're working with community college system to say, how can we incentivize more time, which is so complicated, right? Because it gets into some issues of accreditation and what students are allowed to receive stipends for and what they're not. And so this isn't like an easy fix, but we also said, what are we doing to recruit our existing nurses, people that are already licensed, that are already working in the field? Maybe they made a decision 10 years ago that behavioral health wasn't for them. How can we invite them to reconsider? How can we say, come try it out, come do a little fellowship with us. We'll make it worth your while. Come see what this is like. It might be a good fit. You won't know till you try it. So these are the kinds of things that we want to encourage people to get creative, to think what has not been tried yet. What are the actual needs? What do we actually have to do to bring talent into these areas, whether that's geographic area or a particular aspect of the field. And then just like with most strategies, I think of this nature, you do end up having to allocate a certain amount of money for marketing and research. And that just goes with promoting the profession, especially right now when the labor market is so tight. And it is. Those of you who are involved in hiring know what I'm talking about. Everybody needs to hire. I've got young adult and teenage kids, and sometimes it honestly makes me a little bit sick how easy it is for them to get jobs compared to when I was their age, right? I feel like I had to hustle, but workers are in such demand everywhere that, people are incentivizing right or left. They're raising wages, they're throwing hiring bonuses around. And so we need to be a lot more deliberate and a lot more intentional about educating the workforce about the opportunities that they have within the behavioral health space. In terms of some specific things that these marketing dollars will do, the legislature does call out the need to diversify our workforce. And this is directly linked to access. We know that, if our workforce doesn't represent our population, if they can't see themselves in our workforce, then we're going to have problems with seeking out services and using services. It also means, again, in such a tight labor market like we're in right now, it means that if we're not tapping into talent pipelines from some demographic groups, if they feel excluded or don't see behavioral health as a space for them, then we're missing out. We are missing the opportunity to recruit from talent pipelines that we desperately need. This also means outreach around career pathways. So again, letting people know what opportunities are available to them through different facets of behavioral health. Maybe one thing's not a fit, but maybe there's something else that's a great fit for you. And then paying particular attention to these areas where we have high shortages and we're in high need, those job families. And then the very last priority down at the bottom, because it doesn't represent a significant amount of money, is the workforce development team here in behavioral health is really kind of right now a team of one, and that's me. We have the strategic project manager, Kristen, who's working with us on a short-term basis right now and has been invaluable. This legislation did also fund 2 full-time positions, which we hope will be hired in the fall, that will help the implementation phase of the strategy. But we are keenly aware that in order to make a difference, especially over time, not just in 1 or 2 years, to make a difference in the behavioral health workforce space, we need more information. We need more data. We need to find areas where policy aligns with funding. So we have set aside a small amount of money to accomplish a few things. One, we want to heed the call for state agencies to lead out in providing internships and apprenticeships. So we plan to have, over the next 2 years, we plan to have our own intern each semester that will focus on things like policy development, data research, project management, trying intentionally to keep it broad so that it's a possibility for students from a range of majors, but a chance for them to get some, solid work experience working on things that will directly impact Coloradans. Second, we plan to contract out additional research around critical issues in workforce development, such as why do people leave the state? How many are leaving the state? We hear anecdotally that they are. We hear that they're being lured away by states, especially at clinician level, that states are offering attractive, whether it's assistance with housing or signing bonuses, or we want numbers. We don't want to just hear about it. We want some numbers, and we want to understand what motivates that. We want to understand better, is cost of living an issue? Are they moving to places where their dollars stretch a little further, because we can't formulate policy suggestions and recommendations until we know what the real problem is here. So we want to figure that out. We also plan to contract out an employer needs assessment within the state of Colorado, because I feel like that's a really crucial piece to us being able to meet those employer needs. Again, it's valuable to have anecdotal data, but I really want to make sure that we're not just elevating certain voices and not hearing adequately from others. And then, of course, developing policy recommendations, especially around things that we've identified as barriers, because not everything is a solve by money problem. Some things are a solve by a change in policy or protocol. So those are the priorities that have been identified, the things that will move forward as a result of this particular bill. And we're now going to move to the discussion phase. I'm going to go ahead and put all of the questions up at the same time. I'm cognizant that we have less than 20 minutes. And so I would like you to just focus on the questions that resonate with you, the things that, that are most important to you, rather than working through them one-on-one. So with that said, I'll open up the floor. And Kristen, if you're moderating the chat, could you be my reference for questions that come in via the chat? Otherwise, feel free to unmute yourself and share a question. I can't see people, so I can't really call you out.
We have a few questions in the chat. I don't know if anyone wants to come off mute and ask them, or if you prefer that I read through them.
Is there anyone who wants to come off mute? Otherwise, we'll just let Kristen know about it.
That's a good question. I was wondering, has there been any consideration, another systemic barrier that we hear a lot about is housing. And I used to be a teacher too. So just going back to my teaching days, like I remember there used to be, I think it was a federal program for the Good Neighbor Next Door that supported teachers in purchasing homes, police officers, firefighters, like people in your community who are really on the front lines. And so wondering if there's any consideration to do something, and I know it would not be an easy lift, but something that would give mental health professionals a pathway into that kind of environment.
Yeah, it has certainly come up in conversations. And I think there's two ways to approach it. One is, on a very short term, almost one-time basis, to look at that as part of the innovative recruitment strategies that we've talked about. Obviously, that would be pretty limited in scale, and it would be, a one-time thing. And the other would be to collect some hard data around how much of an issue is that, and how much of an issue is it across different areas within the state. Because I think most of us could see areas where there's housing shortages more than in other areas. And so looking at like, what would implementation actually look like if we have some pretty compelling data showing that that's a barrier. That's something that we can take forward to the legislature, and ask for like a longer term solution. But yeah, thank you for bringing it up. It has come up, and I think it's an important thing that we need to, as we move forward with more longer term strategy, we have to take that into account. Housing is the largest piece of cost of living, but cost of living is certainly a barrier.
Hi, I was asking about compensation, and it looks like that isn't really going to be able to be addressed with the money that's being allocated as well. And I was a little bit concerned with going to businesses to ask them what their workers need instead of asking workers what they need, because sometimes those can be in direct conflict with each other. is there any plan to reach out to, I know this is how we reach out to people that work in the field. But I was a little concerned with prioritizing what businesses want, without outreach to like the people that actually work there, or without a piece requiring them to consult with workers, or or like have you consult with them.
I think that you raise a couple of valid points here. And one is, so I'll hop around a little bit in addressing them. One is, we have not yet established any parameters for those employer retention grants. And so we can put a parameter in there that says, have you consulted with your employees? And we can structure it however we want to have them prove to us that they have done that. We could say you only qualify for this grant if you have an employee advisory board that, came up with the recommendations, or I don't know. I'm totally brainstorming. This is not something the work groups have discussed.
Yeah, I just feel like it's hard because people work for those companies, and so it's their job. So when they speak to their employer, they might have to be more circumspect than they would be if they were being consulted away from their job.
Right. So the second piece to that is, we do see the need to do further research to actually understand the workforce needs. And so that comes into that piece where I'm saying we're going to, I talked about doing an employer needs assessment. But part of that, so for example, if we're trying to understand why do people leave, a big one is migration out of the state, but it can just be a broader, why do people leave the behavioral health field? That is going to involve talking to actual employees and saying, why did you leave? What would have made the difference for you? I realize this isn't perfectly answering your question, but I feel like we want to start down that road.
Yeah, I mean, that's kind of making sure that that's prioritized more than a business that may be working for profit and maybe at crosshairs with the actual workforce we're trying to retain, with like really long shifts, with really bad ratios, like with other parts of the task of behavioral health sucking money out. I don't know if that's happening or not, but I always want to know, are the people administering, doing all the administrative portion of behavioral health, is that a chunk of where money is going? And I haven't found out if that's the case or not. So thanks for answering my question.
No, these are good questions. And I think you're also bringing up why we have to continue the conversation, right? Like, this meeting is not the final word, and not even close, because we have to keep thinking through all of this.
Yeah, exactly. Even because our solutions today may not be the right ones for tomorrow. So yeah.
I think we all learned that with COVID, right? We thought we understood how to do things, and then the world kind of blew up.
Yes.
But the silver lining, I think we've all learned to be more nimble, right?
Along the lines of thinking of the current workforce as well as the future workforce, there are a few questions in the chat around paid internships and clinical supervision, noting that while funding for paid internships will be helpful, financial support to cover the cost of paying for clinical supervision for licensure for early career mental health professionals would be helpful, noting that assistance for those supervisors overseeing interns can usually be a challenge for the provider who is acting as both a provider and a supervisor. So Wendy, do you want to comment on pre-licensure?
Yes. Oh, I'm so glad to hear that comment, actually, because that came up many times in our work groups. And I don't think we have found a perfect solution yet, but we're really mindful that that is a barrier. So it's not enough. I agree 100% that it's not enough for us to just say, we're going to provide all these stipends to fund the people that are doing the internships without taking into account whether that burden can be supported by the supervisors that are doing the supervision, which is more than just the one supervisor as well, right? Like, it's also just the whole operational structure. Can the institution support that? So I don't have an answer for you, a solution, but I can tell you yes, we are aware of that. We've tossed around some different ideas of how that might look if we were to provide, some way of support. One of the problems we've run into so far is that, again, there's not a one size fits all. Like if we come up with one particular solution, it might work for this clinic, but it wouldn't work at all for a different clinic. So we're still working on it, but we haven't given up. And, the final iteration of this may very well include a piece that addresses that burden on supervisors. So it's good to know that great minds are thinking alike on this in recognizing that problem.
Along the supervision line, more than just the financial compensation pieces and the stipends, does this effort have authority over like regulations and paperwork and supervision? So for example, LCSWs can't be supervised by anyone but an LCSW. And so if you're talking rural areas and there's not, you have a lot of supervision burden if you're the only LCSW in the area because everyone has to come to you versus why can they not go to a PhD, or if they're working in a integrated care center, someone that has that expertise, but not the same licensure. But there's so many regulations at the door that doesn't allow you to cross supervise. Some of the paperwork and the regulations can slow down licensure if students aren't aware of timelines. I had a student in an internship program that got delayed by a year because of some door requirements. And so it's some of these things could be systemically fixed, but is that within the scope of this? Or are we looking more at the financial and the workforce?
So two things. One, as far as financial, the bill specifically allows funding to address these. So anything that we can help by money, this bill is an opportunity to do it, right? But just like you've pointed out, not everything is a fix just by allocating funding for it. However, the bill specifically calls on us to work with DORA to identify those types of barriers and come up with solutions. I love the example that you gave because I think that is a perfect example that demonstrates why our rural areas struggle sometimes, because that is a bigger problem in a more rural area than it would be in a more metro area. We have DORA participants were part of these work groups, very active participants in the work groups, and they are aware that we've all been charged to collaborate moving forward. In the actual strategic plan, the document that will be presented to the legislature based on this work that we've been doing, there is a key part that says, I don't remember how it's worded, but basically it says we're going to set up a regular ongoing meeting with DORA to work through kind of point by point these specific issues that have come up, these specific barriers that we have identified where it has a direct impact on, your example of a social worker out in a rural area. Those are the kinds of things that we need to kind of work through point by point, because they are complex, right? It's not like we can just have a sweeping change that makes everything perfect, but we can thoughtfully and deliberately consider how we can maintain the standard of service while still increasing access.
Wendy, one of the other questions in the chat, much of the focus seems to be on individual adult mental health concerns. Working with infants, young children, and their families is so crucial to overall mental health in our state and requires specialty training and billing in a system that is so individual focused. That goes for all work with children. Just hope that thinking about the workforce conditions for working with children and families is being held in our minds as we develop the plans. Do you want to comment at all on how we're thinking about children, youth, and families?
Yes. First of all, longtime foster parent, more than 20 years as a licensed foster parent and mom of 6 kids, all adopted. Child welfare is, just right at the heart of who I am. So I would never want to intentionally leave that piece out because that is my heart. That is especially for those very, very most vulnerable members of our population. The easy answer is they have not been left out. They are part of pretty much every initiative that we've put here. It's just not spelled out. But we had representation in all of the work groups from our CYF colleagues. And as far as implementation, right? Because we're not, this plan that we tried to just give you like big picture, this is what we're doing, but the implementation will have specific pieces where it will be like, this is for, the youth peer support. This is for the adult peer support. There's several different types of peer support that we want to emphasize across the state. And as for example, as we develop our LMS, we've been in really close alignment with the work that's already been done to provide training around children, youth, and families. And how can we align with that? How can we support and build out in our meetings? We have meetings every other week with our LMS development team at CU. And, they if you look at like the map of all the different topics and the different populations, a very prominent one is our children and our youth. So I don't know if this is assuring you adequately, and maybe we should have spelled it out a little bit more in this plan, but definitely not forgotten, definitely a key population that we are keeping in mind as we move forward.
I think we have time for one more question. I'm going to encourage people, please keep putting comments in the chat box. We'll also be sending out the post-meeting follow-up survey to capture any feedback, but I'm one of those people where when I'm taking a shower, I have the best ideas there. One question that we got, generally, one of the reasons people leave is not feeling supported in their position by management. The nursing industry realized this where they found that people were promoted who were technically proficient but not prepared for a management position. Will the workforce training include some type of leadership development for clinicians as they move into a management or supervision role?
Wow. I mean, my response to that is it has not come up. That's my first response. And my second response is, what a brilliant idea. So we're going to make a note of that right now, because our list of training topics is not even remotely set in stone. It's still under development. Like I said, they've already started working on some that were identified by the legislation, but we can add to that. And we are actively adding to that. So I think that is an incredible idea. Probably very much needed and very helpful. And it would be really easy to make that part of a career pathway, where people could get credit, so to speak, for going through a training like that. I love it. Thank you. This is exactly why we do these public feedback meetings, because the collective value of all of your thoughts is so much greater.
Right. I think we're probably around closing time with 1 minute left.
Any final
Thank you,
thoughts?
everyone.
Thank you again for making time for this meeting. If you do have additional thoughts, watch for the survey link that will be sent out, and feel free to discuss with your colleagues that, if there's anything else that you'd like to bring back to us from the group, we would love to hear it. And if you do have colleagues who are interested, we do have one more session tomorrow at, Kristen, do you have the time? I'm still sharing my screen. That's my.
It's at 1:30 p.m. tomorrow, and I can put the link in the chat here in case it's helpful to share that with your colleagues.
Okay, thank you. Perfect. All right. Thank you all for attending. Have a wonderful rest of your day.
Thank you.